Well, our first guest this evening says his office has been inundated with Obamacare horror stories, and he continues to push for the full repeal of the health care law. Joining us, Congressman Scott Garrett, a member of both the House Financial Services Committee and the House Budget Committee. Congressman, welcome to you. So you say 800,000 people in your state, New Jersey, of course, will lose their insurance of Obamacare. We've got roughly 5 million cancellations and counting across this country. What is the status of New Jersey and the Affordable Care Act?
So as you said, you have the numbers absolutely right that more and more letters have gone out already. 800,000 people are going to be notified that they just won't have the policy that they want to keep. And of course, as said over and over and over again, this is just contrary to the promises that the president has made. And I was just looking backstage on my BlackBerry all the many times that he said it, and he said it so emphatically that if you like your policy, if you like your hospital, if you like your doctor, you'll be able to keep it. And then after that, so much of our attention is focused on the president saying that, but everyone else from the administration, from the vice president said that, to Speaker Nancy Pelosi said that, Harry Reid said that that was actually part of their core principles of Obamacare, that you'd be able to keep your policy. But to the people in New Jersey, they're not living up to their core principles, they're not living up to their promises.
You're exasperated by all of this.
It's very frustrating. So I'm just like Speaker Boehner, I too, as a member of Congress, will have to go onto the exchange. That's a law. Basically, we have to go on there. I've had one member of my staff, I've asked my staff, because my staff all has to go on there as well. Mm-hmm. One of my members of staff, it went on. It took over 4 hours, multiple attempts to get on there. I'm going to have to do that one of these days as well.
What a time suck. You're putting that off as long as possible, I would imagine. So let me ask you about the president's announcement putting off the registration, right, the enrollment, until after the 2014 midterm. I mean, that is so transparent and political. It's clear they just don't want this to backfire on any Democrats whose positions, whose offices are in peril.
Right. So much of what they've done so far is political. Just the action just a week or two ago, there's so many actions that they've taken. Mm-hmm. The action when they said that when they directed the states to be able to change their policies, that supposedly the people will be able to keep their policies. The administration had to know with regard to that as well that insurance companies could not literally be able to comply with that or have the availability to do that, so people will not be able to keep their policies. The issue we're talking about as well is done purely for political purposes. It sells well right now with the American public. I'm fixing the problem once again. It also sells well for the Democrats in November of 2014.
Congressman, I don't know how well it's selling. We have this new Kaiser Health tracking poll. 33%, only 33% of Americans right now have a favorable opinion. That is a record low of Obamacare. Do you think this is actually going to finally backfire, if you will, on Democrats in the midterm? What do you think about the Senate? You think Republicans will get a majority there?
Yeah, so I think it will backfire. You know, going into Obamacare during the whole election, or not the election, whole process to that, we had hundreds of thousands of people complain about it, come down to the White House, circle the White House, remember, vote no, kill the bill and what have you. But for the vast majority of Americans at that time, Obamacare was something just in the news. It wasn't affecting them. Now it's affecting them, and now it's affecting their families, their parents, their kids. College kids will soon learn when they go back to college again in the spring, when they get the notice saying that you have to have college health care on campus. Mm-hmm. You can't have the old policy anymore. Your prices are going to go through the roof. So all this means is that it's a good thing for us trying to repeal it, and also a good thing to try to retake the Senate, to your point.
Do you think you will have success this time around repealing any? I mean, you're laughing at me because that totally backfired. Well, success in the Senate, but obviously the strategy, the Ted Cruz strategy to defund, link the defunding to the last budget was a disaster. And it was like Democrats had 2 weeks of a reprieve in a way before we realized that this thing was about to implode, right? A rolling disaster, as someone described it.
Ted Cruz and the rest of us probably knew that the system did know that the system was a disaster. We just did not know how much of a disaster it was going to be so quickly. Had we known that, we probably would have put off our efforts to just a week or two down the road.
So let me ask you this. What is New Jersey doing? We're reporting that 10 states have basically denied the Obamacare fix. I know the New Jersey Insurance Commissioner, right, is still considering this. What do you think is the best solution for your state? Well,
the commissioners really don't have any real latitude in this area. The administration is saying that they do, right, on the one hand, but in reality, state insurance commissioners are pretty smart. They understand that insurance companies do not have the flexibility to do what the White House says they can do, and that is to turn on a dime after cancellation notices have already gone out. And without getting the details, but basically it's the law of large numbers. You need a large pool in order to have an insurance policy to exist. it's shrinking now automatically. That's why they just can't reinstitute these things.
This is that death spiral they talk about,
Very
right?
good, exactly.
You need more young people in there, otherwise, those higher costs for the elderly and the sicker Americans are just going to weigh the program down and automatically kill it. I want
right on the mark, exactly.
Okay, talking about politics and strategy, this nuclear option, Harry Reid changed the rule in the Senate, basically only need 51 votes to kill the filibuster, right? So is this a deflection technique on the part of the Democrats?
Well, in a way, but I guess it's also a technique just to follow the lead of the White House. The White House is not following the law in so many ways. They're not following the rules, and Harry Reid decided he's not going to follow the rules anymore either.
So one thing it does is it allows Congressman Mel Watt to potentially oversee Fannie and Freddie, and you chair the subcommittee on the government-sponsored entities. Now, we know that he's very in favor of reducing mortgage principals, right, to help people in these underwater mortgages. And how do you feel about that? Is that just another version of some kind of government bailout? Yes.
So, first of all, I know Mel Watt. He serves on the committee with me. I've known in the past when we tried to do reform, unfortunately, he opposed the reform that a lot of us tried to do. So I anticipate if he were to be confirmed, he would oppose any reform going forward. And so it's going to be a problem. Right now, you have a very good guy who's running the program. Ed DeMarco is running the program at FHFA. He's done an exemplary job of trying to make sure that the taxpayer is not put on the hook again. Some of the ideas that Mel has proposed in the past would do just the opposite, would put the taxpayer on the hook. And by basically rewriting the mortgages so that people's mortgages go down puts more taxpayers on the hook on the one hand. Also is, maybe it's the same hand, I don't know, is also unfair to the American public at the same time. That's it.
These are busy times, Congressman. Thank you so much for addressing some of these pressing